When you or your family is sick, you certainly want the best care possible. One of the first healthcare professionals likely to help you, a nurse.
The American Association of Colleges of Nursing says there is a shortage of them, and as Sabrina Burse explains, the problem is only getting worse.
Registered nurse Paula Booker started caring for cardiac patients at Coliseum Medical Centers almost 20 years ago. It's a job that requires a lot of heart.
When I was a child, my mother got sick, so I kind of became her caregiver.
But over the years, you'll find fewer and fewer registered nurses like Booker in hospitals and doctors' offices. The American Nurses Association says in 2022, there will be far more registered nurse jobs available than any other profession in the nation, with more than 100,000 jobs coming on the market each year. Chief Nursing Officer Bridget Denzik says there are many reasons for the shortage, but it begins in the classroom.
The nursing schools are not able to provide typically enough nursing instructors to meet the need.
That sentiment is shared with the Department Chair of Nursing at Middle Georgia State University, who says for every student enrolled in the nursing program, one student is turned away. Now, another reason for the shortage is a large number of the current nurses are nearing retirement age. That's according to the American Association of Colleges of Nursing. Coliseum leaders say they sometimes fill open positions with contracted nurses from across the country for weeks or months instead of full-time hires. Booker says on her floor, RNs are typically responsible for 5 patients per shift.
You have to have excellent organizational skills, prioritizing. We usually go to who's the most sick or who's in the most need.
That 1-to-5 ratio is below the recommendation of National Nurses United, one of the largest associations of registered nurses. Their guidelines suggest 1 nurse for every 4 patients in the medical and surgical units. Booker says when the number of nurses at some hospitals don't add up, it's the quality of care that breaks down.
I would think this is detrimental to patient care.
And it doesn't stop there. Denzik says as baby boomers retire, hospitals are losing those older, more experienced nurses and gaining patients.
We do have some international nurses, however, that we had recruited, and so we have a small number of them who help to fill those vacancies.
To recruit people to the profession, Coliseum works with college nursing programs like Middle Georgia State, Mercer, and Wesleyan College. Denzik says the partnership with these schools help the hospitals recruit students and in turn fight the shortage head on. But until the number of nurses reach the demand, Booker says the shortage will always be a threat.
Ultimately, it's all of us that suffer because at some point or another we're going to be a patient.
In Macon, Sabrina Burse, 13 WMAZ News.
At the Medical Center Navison Health, they're also taking steps to deal with the nursing shortage. That includes offering tuition reimbursement and programs for high school students who are interested in nursing.
Coliseum Medical Centers has a job fair on February 28th at the Marriott Hotel on Coliseum Drive from 10 a.m. until 3. No appointment needed.